Thank you very much, Ruth, and thank you very much for inviting representation, really, from the Clinical Board to come and speak to you. The Clinical Board has actually undergone a slight transformation in that we are now the Clinical and Professional Board, recognising that clinical seemed to indicate that it was just purely about health, and there are many, many professionals who our patients and our communities depend on, who are not necessarily doctors, nurses, physios, and this is very much to represent the professionals who work in social care. I'm presenting today on behalf of Fiona Armstrong, who's actually been a co-chair for rather longer than I have. I'm actually a novice, and I'm also speaking on the work that was led by Sarah Phillips and Peter Maskell in the early part of the Clinical Board. So what I'm going to tell you is what the Clinical Board has been up to in 2016 into 17. Some of the key challenges that have been posed for us in the Case for Change that was published in March. Some of the burning platforms that exist in Kent, particularly in the acute sector, and what we have done so far, particularly against the 5-year forward view gaps that were talked about earlier, and then where we're going to go in 17 to 19, and in particular, the creation of a clinical strategy for Kent and Medway. So, there are many challenges across our system, and from the Case for Change we originally set up 4 work streams, and you can see that they are prevention, and many people talked about prevention this morning, local care, and Caroline and her team are going to talk about all the work that has been done in the local care work stream, hospital care, which I will talk about a little bit, and mental health that Helen will talk about after I've finished. So I'm not going to go into great detail, but and this is not an acute care takeover, but because I am an acute care person, I'm doing the acute care bit and leaving my experts to tell you about their work streams. So we were faced with 10 key areas in the Case for Change, and they're very wide-ranging. But the bottom line is that there are too many people using hospitals when they don't need to. We do not have good outcomes for mental health, and even more importantly, those with mental health don't have good access to healthcare. The Case for Change didn't address the needs of children, and particularly in the area of prevention, and that is something that we will put right in the coming year. And that all of our services could run much more efficiently across Kent and Medway. So we've started to develop prevention strategies across Kent and Medway. Our local care model has been developed and is beginning implementation, and as always, different parts of the system go at different speeds, but it's really important to acknowledge that there is not one solution. The principles are the same, but the solutions in each area will depend on their local communities and what they need. We need to develop consolidation of some of our services because they are not all equally viable. And this shows how some of our acute trusts are not able to meet the national standards. And in this diagram, the blank circles are those services that are not provided on those sites. And the darker the circle, the less the service meets the standards. And you can see that there are several services, including in our acute care particularly, where nobody in Kent fully meets the national standards. And that is not something that we can continue to accept. At the bottom, you will see that stroke and vascular have been highlighted in pink. And these are areas where, for stroke, there is no unit in Kent that meets more than 2/3 of the national standards. And therefore, our outcomes for stroke are not as good as they should be. And so we have concentrated this year on the stroke service, and now are about to go to consultation in the spring about those services. Again, in vascular, we don't meet the service needs of the people, and there's a large piece of work going on to develop a centre for arterial work with a spoke system into the rest of Kent. Here we talk about the different gaps in care that were identified by the 5-year forward view. So you can see all the things that we are starting to pull in order to get the best evidence of where we should be going. And for prevention, we have identified 2 and now have policies for smoking and obesity that will be rolled out across Kent. In the care gap, we've looked at a whole range of different information and data, and we have taken action, as I've already said, on vascular and stroke, which will be coming in the next 18 months or so. And there's work going on in East Kent, particularly on orthopaedics, that urgent and emergency care, and in local care across Kent and Medway. The financial gap, there's a large amount of work going on how we could do things more effectively and more efficiently, and in doing that actually provide higher quality care. So the finances will only work if we actually provide better care with the resources that we have, and that is what we aim to achieve. So over the next year, we're going to develop a clear clinical strategy which is based on an engaged and widely consulted on vision. Each of the areas that are identified as our priorities will consider prevention, well-being, holistic care, as well as being patient-centred and co-designed. There will be a coherent pan-regional clinical strategy with consistent care and quality of care at the heart of it. And I think we have agreed that pan-Kent and Medway, because there will obviously be things that need to be delivered locally and decided on locally, but there are some where we do need to take a view across the whole of Kent and Medway. And that will be on prevention, mental health, cancer, and children and young people services, all of which are areas where at the moment Kent is not doing as well as it should. Over the next 3 months, we're going to review the case for change and put right the 2 areas that are less well covered, and these include mental health and children. We will come up with a shared Kent and Medway clinical vision, and I hope those of you that are going to come to the clinical strategy session will help by being the first stakeholder group in developing that vision. So I would encourage you to come to that workshop. Flagrant misuse of this podium. But we will also be developing models of care that are based on what the population needs, not what the health professionals are prepared to deliver. And I think that's something that the health service has always struggled with, is that the workforce tends to be the people that tell the population what they need. And we want to try and reverse that and actually have a co-designed health service which is designed by the population as well as by the staff. So thank you very much.